Hey, welcome to Chris JRS. My name is Chris, and in this video, I'm just going to be doing a quick recap on the situation that I was dealing with last week. So last week I didn't post a full video. I ended up posting a short, and that was because I was having some issues with my elbow and I wasn't able to edit. I wasn't able to do a lot of things, but that's what this video is going to be about. It might be a little controversial toward the end, but just bear with me. So one of the first videos I ever posted was about gout and my experience with it. So I haven't had any gout flare-ups in the past year or so, but last week was the first time I had a flare-up in over a year. So what caused that flare-up? Well, let's just go back a week before that and start from the beginning. So about 2 weeks ago, I was working out, and yes, that is something that I do on occasion, but I was working out and everything was fine. The next day, I started feeling a pain in my elbow. So I thought maybe I just overreached or something and I hurt myself while I was working out. So I took some rest. I didn't work out for a few days. So that was a Thursday where I worked out, Friday I didn't, Saturday, Sunday. The pain was still there. It started gradually getting a little bit worse. So it was in my elbow. Didn't think much about it. Just thought, whatever, it'll pass. So then by Monday, my arm started feeling a little bit worse. Like my range of motion went from like that much to probably just that much. And I couldn't, it was really painful. So I still kind of ignored it. Then I thought to myself, maybe this is gout. Now, generally when I get gout, and most people get gout, it affects their toe, but gout can affect you in any joint. It can be your ankles, your knees, your elbows, your fingers, whatever. So I've never had it in my elbow before. I've only ever had it in my toe. So I decided, okay, I'm just gonna take some of my gout medication, because I haven't been taking any gout medication for the last year. So I ended up taking this one, and it really didn't do much. But I was like, maybe it's not, maybe it still is just some kind of pain I did from when I was working out. So on the Tuesday, it started getting worse. I couldn't really move it at all. So I started taking Celebrex. Wednesday, did it again, took Celebrex, it helped a little bit. Thursday, it got worse, and I decided, okay, I'm gonna go to a doctor now to see what this is about. So I'm calling my doctor up. He said he wanted me to come in so he could take a look at it. And he said it looked like olecranon bursitis, which is, in your joints here, you have a fluid sac. In all your joints, you have fluid sacs, and if that gets infected somehow by hitting it too much or just something, it can get inflamed and it can cause a bulging. And he looked at it and said it was that. So he said, continue taking the Celebrex, that's fine, and if it helped. Now that night, after I left him, it actually got even worse. It was like I couldn't sleep, I couldn't move my arm, it was just stuck in one position, and I started icing it and everything. But again, I kind of ignored it. I'm like, let me just wait for the Celebrex to kick in. So the Friday came along, again, still couldn't move my arm, and it was probably even worse. And I was like stuck in one position, couldn't move it at all, and it was just there. So Friday night, it was really painful, so I decided, all right, I'm gonna go to the hospital and get a second opinion and have a doctor take a look at it. So the doctor looked at it, and as soon as he saw it, he said, yeah, that's gout. He's like, yes, there is olecranon bursitis, but it's the gout causing that. So I did some blood work and some x-rays, wouldn't get the information right away. So he ended up giving me some more pills to take. So I took prednisone, and within a few hours, the pain started really subsiding. So it was confirmed by him that it was gout. A few days later, my family doctor got their blood results, the blood test results, and he said, okay, yeah, it is gout. Your uric acid levels are high, so I need to be started taking some medication to lower my uric acid levels. I still didn't really want to, just because, I don't feel like I need to as yet. So, like I said in my past video before, I will take it if I really do need it, but this was just a one-time occurrence. The first time I'm getting a high reading in over a year. So I thought maybe I can bring it down myself. If I do have another one within another month or so, then yes, I will go on medication that I need. But one time in a year, I think I can still manage that. Now, in the last year and a half, what have I been doing differently? And hasn't really been much. If you eat high rich red meat or shellfish or drinking alcohol, that could do it. I don't do any of that much, and I really haven't done any of that last few months. So what did I do differently now that I haven't been doing the last year and a half? And there is one thing, and this is where it may get controversial. So I did get a recent vaccination. I got my second dose of my COVID-19 vaccination. After the first dose, I was fine, no issues. Second dose, again, no issues. It was about 9 days after the fact. That's when I got my gout flare-up. I thought, let me just look it up and see, is there any kind of correlation? So this is not to dissuade anyone from getting their COVID-19 vaccination or anything like that. This is just something that I didn't know and that I actually looked up, and there is a little bit of research. Now it isn't, so if you do have gout and you get any kind of vaccination, it doesn't have to be the COVID-19 vaccination, it could be for shingles, it could be for flu, it could be any vaccination at all. It can possibly cause a gout flare-up. So the first place I started was Reddit, and probably not the most scientific place to start, but I just looked up COVID vaccine and gout. And people from a few years ago, before this vaccination even came out, were saying that they got their flu shot or their shingle shot, and that they got a gout flare-up right after it. So I did a little bit more research, and I didn't want to just stop on Reddit because that's not where you really want to be stopping your medical research. So I came across on the Mayo Clinic website, which is a little bit more official. Under gout, they have the overview, their symptoms. You can go down to risk factors, there's diet, weight, and so forth. And the last one here where it says recent surgery or trauma. So this is where it caught my attention, where it says experiencing recent surgery or trauma can sometimes trigger a gout attack. In some people, receiving a vaccination can trigger a gout flare. So it doesn't have a specific vaccination name, but it does say receiving a vaccination can trigger a gout flare. So what does that have to do with this whole video? Well, now, like I said, I'm trying to say this as eloquently as possible with having my words not taken out of context. But what I'm trying to say is, if you have gout or you think you have gout or whatever, and you need to get a vaccination, any vaccination that is, I would suggest probably doing the vaccination, because a gout flare-up can happen, but you can control that if you knew. Now, I didn't know about this, so if I had known that getting that certain vaccination would have caused a flare-up, then at the first onset of me feeling something, I would have taken pills right away. I would have taken some kind of action instead of waiting almost about 4 or 5 days before it got even worse. So right now, if you have gout and you have a flare-up and you just got a vaccination, then maybe it's a little bit too late for you, but now you know. But if you are anticipating taking a vaccination in the future and you have gout, well, at least now you know there's a possibility that you may get a flare-up within a few days of it. For me, it was 9 days after. So again, for me, it didn't have to be the vaccination, but that in the last year and a half, that was the biggest change that I had done, and I think it seems a little bit close. But again, like I'm saying, this is not saying don't take a vaccination because you're gonna get a gout flare-up. No. If I knew I was gonna get a gout flare-up, I would still take the vaccination, but again, I would just take precautions before I felt the onset coming on. I would have taken my pills right away. So that's just for you to know. Because even though a lot of people who have gout know that this is a possible reaction you can get. So again, I just want to go over, I just want to say I'm not a medical professional or anything like that. You know, speak to a doctor if you have any questions about this. But all I'm trying to say in this video is that if you have gout and you haven't received any kind of vaccination, or you're going to receive vaccination, then it's possible that you may get a flare-up within a few days. For my case, it was about 9 days after the original flare-up, but who knows, maybe it didn't cause it at all. Maybe it was something else I was doing and I was just didn't realize it. And just a side note, while I had my elbow issues, I was using the prednisone, which seemed to work. I also got one of these things, which is a copper sleeve. Again, this is not sponsored or anything like that. It was just I wore it on my elbow. I don't know, I just wore it like this. It seemed to help. Didn't make it worse or anything like that. Might have sped up the recovery. It took me about a week or so from taking the medication to get full range of motion back. There is still a little bit of tightness right here, but compared to what it was last week, yeah, I'll take this over anything. So this is a compression sleeve that I've been using. It's supposed to help blood flow into the area. I'm not really sure if the copper does anything or if it's just a gimmick, but it didn't make it worse, so whatever. If you're gonna get one of these, At least for this brand, you need to measure around your bicep. I didn't. I just assumed it was a medium because I didn't think my arm was going to be that big. But when I got home, it was too small, and I ended up going back and returning it and get a large because 13.5 inches. Alright, so I'll end things there. And like in my previous gout video, I said if I had any flare-ups, I'll do a follow-up video. Here's my follow-up video. If I have another flare-up from here on out, maybe I'll just do a short. I don't think I'll do a full video. We'll see. You know what you can do. Everything should be down below. Leave a comment. Let me know, have you been dealing with a similar situation that I've been dealing with? And if not, then cool. And until the next one, I'll talk to y'all later. Have fun.